In this video, we'll talk about the synovial fluid analysis, how we approach different diseases based on the synovial fluid findings, including the red blood cells, white blood cells, and the glucose levels, as well as the color and the viscosity. So let's see, this is the joint, and here we have the synovial fluid. First step, we have to know what is the normal synovial fluid analysis. So first of all, white counts will be less than 200. That's normal, no issues. And also you think about synovial fluid as plasma filtration fluid, which has protein, glucose, and also hyaluronic acid, which is responsible for the viscosity as we mentioned in the first video. Now, I wanted to think about white blood cells and hyaluronic acid as competing structures in the synovial fluid. Whenever you have higher white counts, hyaluronic acid will be less, and so viscosity will be lower. So in non-inflammatory diseases, white count will be a little bit higher than normal, which is around 200 to 2000, and also some RBCs will be present secondary to wear and tear disease, and hyaluronic acid will be less since white count are elevated, so viscosity will be lower. And the color will be more orange because we have more RBCs than normal. Now, in inflammatory diseases, white count will be more elevated, which is around 2,000 to 50,000. And also, hyaluronic acid will be lower because of higher white count, and viscosity will be lower as well. And the color will be more reddish because we have here actually more RBCs than non-inflammatory diseases. Now, in septic arthritis, the main structure that is increased is going to be white count, more than 50,000, and RBC will be present as well. Hyaluronic acid will be much less, so viscosity is going to be the least in septic arthritis, and the color is going to be more whitish than reddish because we have higher white count than RBCs. Now, the next question will be, when do we do a retrosynthesis? And the answer will be any acute effusion, even if it's on top of chronic monoarthritis. What do we send for? White count, gram stain, and also we'll send for cultures. We'll also send for microscopic examination looking for crystals, and that's monosodium urate, which is present in gout, and calcium pyrophosphate, which is present in pseudogout. Next question will be, which is important in boards, when do we do synovial biopsy? And the answer is any chronic resistant monoarthritis that you don't have a diagnosis, you want to send for biopsy looking for TB or fungal infection.